So the Trios I primarily use for a few different functions. We can use it like traditionally was intended, where we would use it as a scanner for restorative purposes, for example, so traditional crown and bridge work or veneers. But we have gone into different fields or different applications now where we can do a couple of different things which are really cool. Something that I use quite often now is this patient monitoring. So I'm building up a bank of initial scans, and then at 6 and 12-month recalls, we're taking further scans. And what I'm hoping to do with that is demonstrate to patients, for example, the wear facets that are developing on teeth, the changes in terms of the dentition, in terms of wear and cracks and things like that which are developing on the teeth. And previously, what did we do? Well, we took study models every 6 or 12 months. For one, patients don't like having traditional impressions taken. For two, dentists don't have enough time to be taking impressions, 4 or 5 minutes for each impression, taking bites and all that sort of stuff. It's just not practical. But if you can get your nurse or your assistant or a support staff member to do a scan, the scans take, what, a minute per arch, 2 minutes tops for both jaws. We can actually compare that, and over years we can compare what the dentition is doing. We can actually monitor, for example, recession, which, what did we use before? We used a probe, and that's all we had to monitor recession. But now we've got different technologies, and that's something, the patient monitoring, which I'm really excited about, and I think is going to be massive in the next 5 to 10 years, in my practice anyway, as I'm growing the practice, as my patient base is growing, and as they get older as well. Another application that I use quite a lot is the smile design. I love it because, traditionally our smile design has been with a piece of paper, a pen, or with, something like PowerPoint or some Photoshop or something like that. These days, by having a set of photographs and having the application, I can put the photo straight in, and within a few minutes, I can produce a smile design, which allows myself and the patient to visualize what some cosmetic treatment could do for their smile. And the really powerful thing is that we can demonstrate to patients what their smiles could look like with some cosmetic dental treatment. Now, this doesn't mean that every patient that sits down and has this smile design is going to book in next Monday morning with you to have 10 veneers done. But what it does is it plants the seed, and it allows them to take home with them that design so that they understand that they can have some treatment done and what the beneficial components would be for their smile. And they can show their partners, they can show their friends, and they can mull over it. And they often come back the next week or the next month or the 6th month recall saying, do you mind actually talking to me a little bit more about what that procedure involves again and what you could do to make my smile look a bit more like this?